All right, I'll just give some brief introductory remarks for folks on the line, and then we'll kick it over to our great speakers to get going here for today. But thanks everyone for joining our webinar for today. We are really excited to have two great speakers here, but discussing health and the outdoors. So we spend roughly 90% of our time indoors, which is really unfortunate because I think there's just like so much good to be experienced from time in nature. Time in nature is proven to reduce stress. It's improving mental and physical health and is a very COVID-friendly option these days. It's also proven to reduce healthcare costs. So a Colorado report from Outdoor RX found that there's $139 million saved in the healthcare costs since 2011 due to their focus on outdoor rec. Oregon, they've saved or realized $1.4 billion in cost of illness savings due to some of their health benefits that they've identified from outdoor rec. And then a study from University of Exeter found that just 2 hours of outdoor time in green spaces substantially improves health and physical or psychological well-being. So health is one of the 4 key pillars of the network, the Outdoor Learning Network. It aligns our focus with a confluence of chords, and interwoven with these, each pillar is equity, and we're interested in how equity is, how the outdoors can be made readily accessible to all communities. So making the outdoors available to all is key for getting everyone to experience nature's health benefits. So enough of that. I'm going to turn it over to our speakers. So first we will hear from Dr. Robert Czar. He's a board-certified pediatrician at Unity Healthcare in DC, where he cares for low-income and immigrant populations. He's the founder and medical director of Park RX America. It's a community health initiative to prescribe nature to patients and families to prevent and treat chronic disease and promote wellness. So we're really excited to hear about this project. It's really taking off these days, and we're here excited to hear more about it soon. And then we'll hear from Jason Uraz, who is the director of the Blue Ridge Parkway Foundation's Kids in Parks program. This program partners with public land management agencies to convert their pre-existing trail into a kid and family-friendly trails. So with each speaker, they'll give their intros, but just want folks to kind of think about any questions they may have for the speakers during the webinar. We'll have a Q&A period at the end. You can type those questions into the chat box or raise your hand and we can call on you. So with that, I'll turn it over to Dr. Czar to give his remarks. Thanks.
Great, thanks so much, Matt, and thanks to you and Bevan for inviting both of us. Good to see you, Jason. So before I start off and tell you a little bit about Park RX America, I want to just take a few minutes and give a little bit of background and some of my thoughts about bringing together the medical side, and the parks side. And just a quick reminder that, the work that I do, I work with vulnerable populations. I've been practicing for 20+ years as a physician, primary care pediatrician at a community health center. So I see vulnerable, that's what I do. I do poverty medicine. Nearly 100% of my patients are Medicaid. So, and a quick reminder, Medicaid, although 2/3 of the recipients of Medicaid are in fact children, 2/3 of the spending of Medicaid dollars actually goes to adults, especially with disabilities and people who are aged. I wanted to throw out some numbers just to give you an idea. State of Texas, you can see my bolo tie, I hope. That's where I grew up. That's where I trained. I was at Baylor, Texas Children's in Houston, grew up in Austin and Hill Country. So that's really my home before I moved to DC. But in Texas, the great state of Texas, we got about 29 million people population. And 2020, what I found out was about nearly $27 billion is spent combination of Medicaid and S-CHIP. That's what they're spending there. And then when you look at the Texas Parks and Wildlife, they're at 444 million. So 27 billion on health delivery and 444 million only on Parks and Wildlife. Just give some estimate there. About 3/4 of the total healthcare expenditures in the entire country is spent on managing chronic disease. So chronic disease is really sort of this modern day plague. The good news is that we now have over 500 published studies. They range from observational, correlational, all the way up to randomized controlled trials, showing some relationship between a good relationship, that is, between spending time in the outdoors and improved health outcomes. What are we talking about when we say chronic disease? Hypertension, diabetes, cardiovascular health, mental health, including depression, anxiety. It improves sedentary behavior. It improves concentration, attention, productivity, decreases sick leave, all those wonderful things that we all are trying to improve every day. We know from literature that being outside means that you're more likely to move. And when you move, that's an independent risk factor to improve your health. So it's super, super important that we make that distinction right here and now, that being outdoors means that you're more likely to move. And even if you don't move, you're likely to move to get outside. So you're still moving to get outside. And once you're outside, we know that mental health improves and physical health improves. I'm in the midst of a randomized controlled trial right now. I'm a year and a half into it. We have an NIH-funded randomized controlled trial. I'm the co-PI, principal investigator, and a site PI. It's based in Washington, D.C. The PI is Deb Cohen, based in Kaiser Research, Kaiser Permanente Research. And we're looking right now between the ages of 6 and 16 years old. We're looking at physical and mental health outcomes. We're using accelerometry. And we've got 93 doctors prescribing nature parks every day right now. So it's very exciting to see what those results are going to show us in the short and long term. It'll be the first of its kind that I'm aware of that's ever done ever in the world's history. So we're excited to see what those results are going to be. A little bit about PRA. So Parker X America, I often refer to it as PRA. We were founded, I founded it. This was going back as far as April of 2017. It took us about a couple of years to do a lot of planning and building and capacity. And then in January of 2019, a little over 2 years ago, we launched a platform that was in conjunction to our efforts to educate physicians and healthcare professionals, not just physicians, but mostly physicians at this point, about the science, the evidence behind nature, spending time in nature and improved health outcomes. So the platform is really a complement to that. It gives them a way to do this, to prescribe nature, to prescribe parks to their patients real time. And they can do it for prevention, or they can do it for intervention to actually treat chronic disease. And I've done a lot of the trainings myself. So I'm very familiar with the kinds of mindset that we're dealing with when you deal with physicians. And I still, of course, practice myself every day. So we're up to 1,200 and some change, mostly docs around the country, prescribing, who registered to prescribe. So that's the good news. And I've got the research that's ongoing now to look at some pretty hard data, accelerometry, to actually see about moderate and vigorous physical activity, and to look at those changes over time. So we're following these participants for 2 years. That's the goal. And we're having baseline measurements, 3, 6, 12, and 24 measurements. So one of the things that Bevan and Matt asked me to talk about was sort of what can states do? Like, what's the role here? And my understanding is that this audience is a mixed audience in terms of some on sort of the health side, HHS side, and some on the parks rec side. I think my first thing I can tell you all is talk to each other. It's the most important thing. Have conversations constantly about how you can actually work together. I think working together is the only way that we're going to be able to tackle this interest that we seem to have on both the park side and the medical health side about getting people outdoors. The second thing that I would love to see happen is this PR campaign. I would love to see a PR campaign with targeting both the patients, the people, and the providers, the doctors. If people get the message, think about where these Medicaid recipients are. Think about where they live, where they shop, how they transport themselves from one place or another. The message needs to be to spend more time outdoors. Imagine coupling that kind of a PR campaign with the providers, telling them to prescribe nature, and having those very patients go to their doctor and ask them for a nature or a park prescription. The next thing that I'd like to sort of suggest here in terms of what states can do is to either exert some pressure, influence through to the Medicaid contractors. So, you know, about 2/3 of Medicaid has been privatized. So that money is taxpayer money, and you all are funneling that to mostly private insurers to manage these groups of patients who are enrollees in their Medicaid. And I'd love for some influence from the government, from the state government office, to really, you know, say, listen, if you want these contracts, let's talk about tying the contract to a program that is focused on prescribing nature, prescribing parks. And I think that's where we can start to have this influence coming from the government through to the companies, through to the providers. I would love to see something like that. Another thing I would love to see from the states is promoting these public-private partnerships. When you go to a hospital, for example, or you come to my community health center, you generally find what I would call the absence of nature. There's barely a plant in the building. There's no living walls. There's very little. In my health center where I work, for example, there's absolutely no access to fresh air, no access to the outside when you're in the building. No window opens. So imagine a situation, you know, a wonderful situation where you take private-public partnerships and reach out to these eco-friendly businesses, reach out to the nurseries in your state, places. I'm not talking about nurseries that take care of little children. I'm talking about nurseries that grow plants, just so we're on the same page. And imagine partnerships to bring that nature into the health centers so that the doctors, the nurses, the staff are immersed in this. It's really hard to be telling doctors, as a metaphor here, to be giving their patients water when the doctors have no water to drink themselves. That is not the situation you want. So you want to create an environment that is really conducive to prescribing nature. The next is think about the boards of medicine in each of these states. Each state has a board of medicine, and they are the ones who control the licenses for renewing your license, getting your license, renewing your license for physicians. And we're required to have CME, a certain number of credits per year, 50, 30, depending on the state. And we already have requirements that are there for us to do 3 hours of HIV, 2 hours of LGBTQ+, 1 hour of laboratory medicine. We need to tack on to the state boards of medicine an hour of nature and human health. There is enough evidence, I would say, putting on my public health hat, we have a preponderance of evidence now that being in nature is good for you. And doctors need to know that, and they're not getting that education during their residency, during medical education. They need to get it postgraduate. And it just so happens that I just created, I led a small group, and we have now a CME activity. It's 1 hour, and it's free for anybody to watch anywhere in the world. So that's ready to go already, and they can get their 1 hour of credit right now. And we did that through a partnership with the American Public Health Association. Another thing I'd like to see is how the state can be involved in pushing along this idea of mine, whereby you take this electronic health record companies, these vendors, you talk with them, you sit them down, you say, listen, you're providing a platform for, you know, millions, in this case of Texans or any state population, and saying, look, if we can integrate the nature park prescription, or in Jason's case, a trails prescription into the electronic medical record that the vendor standardly provides for these providers, for the hospital, for the delivery system, we have a completely different playing field if we can do that. It's a very, very important step. I also wanted to just kind of give you some breadth of PRA at this point in terms of, I mentioned the providers and how many we have. We've worked with the states, obviously the state park and rec agencies, a number of them, and in some of our states we already have pretty much full completion. We've got most of the, if not most, all of the state parks in a number of states. And I just want to list them out for you so you can know: DC, New Jersey, Washington, Arizona, Maryland, Virginia, Minnesota, Mississippi, Montana, Oklahoma, Tennessee, and I believe Wyoming. And then we have some metropolitan areas. We have cities, urban areas where we have some pretty good completion as well. So Chicago, Salt Lake, Houston, High Country, North Carolina, Portland, Maine, Boston, Pueblo, Colorado, and Anchorage, Alaska. The ones I want to just kind of point those out to you so you know what those are. A little bit more on what the states can do. You know, I want to make, I think that each state can make a really good case for, you know, public money, taxpayer money for public health. This is what this is about. And when we talk about public health, we should be talking about vulnerable populations first. That's one of the sort of precepts in public health, as you all already know. Now, there are also these community health centers and rural health centers, and they're everywhere. They're in every state. I work at one at Unity Healthcare, so I'm very familiar with that. And this is generally where, you know, we've got, you know, tens of millions of Americans, adults and kids that are seeking care, whose care is paid for by Medicaid. So yet one more opportunity for us to think about where we can leverage this sort of state influence. So at the end of the day, I would propose to all of you that we have a state demonstration project. That's what I propose, with an evaluation. That's what I'd like to see. And the evaluation should be evaluating the adoption of the prescription in the MDs and the health professionals, of course. It should be an evaluation of the adoption and completion and filling of these prescriptions by the patients, by the public. Clearly, there should be an evaluation of the health outcomes, because is hypertension, diabetes getting better, et cetera, et cetera. And lastly, how many dollars are we saving by doing this? This would be a fascinating project, an example for all the other states who are shy in taking that first step. And then also just to think about, with those dollars saved, once again, in Texas, for example, 27 billion versus 444 million from the health side to the park side. It makes me wonder if we had a true partnership between these two entities, the health and the parks, and we could show the savings of dollars, why not reinvest that money in our parks and wildlife, or our urban park and rec agencies, perhaps led by the states, of course, but developing green space where these vulnerable populations actually are. Think about where they go to school. Why not create more green space in their schools, in their neighborhoods, where the parents work, at their libraries, at their community health centers, on and on. That's my vision. I'd like to sort of leave you with my vision about where I think something like this could actually go. And with that, I would love for you to see in 1 minute and I think 7 seconds what it's like to actually prescribe, like how to prescribe nature, because you're wondering, what is this guy talking about? And I think Matt has an ability to show you that.
My name is Dr. Robert Czar, and I'm the founder of ParkRx America. I've written hundreds of nature prescriptions, and my patients are moving more, losing weight, and feeling less depressed and anxious. Because I want you to have the same success I have, I'm going to show you step-by-step how to do this. First, log into your account. After you and your patient find the right park, click on the button next to the park, and then press Prescribe. If your patient feels more comfortable and safe somewhere other than a park, like a backyard or patio, then press the Custom Destination button. Write in the activity, frequency, and duration, and press Submit. Now for the reminder. Ask your patient for permission to share their cell phone number or email with ParkRx America. If they say yes, type in their cell or email and set the frequency and duration. Then press Send Reminder. Now click the big blue and white button so you can copy and paste the script into your EMR. Remind your patient to check their text message, which requires their consent. Only then will they receive their reminders. Remind them to press the Yes, I visited this park button every time they fill their script. The next time you see them in the office, press My Prescriptions and use the unique prescription code to see how many times they filled their script. And you're done.